Communicator. Good morning to you, madam.
Good morning, Wilberforce.
It's good to see you.
It's good to see you too.
Yes, and welcome to Asaase ABS. Is this your first time here?
Yes.
Oh, it's your first time?
Yeah.
Okay. So we are also likely to be joined via telephone by Madam Gloria Ofori-Boadu. She's a she's a legal practitioner and managing partner at GOB Law Consult and Adjunct law lecturer as well. She's also going to be joining us via telephone once we are able to raise her. But let's start with you, Ewurabena, here in the studio. Era, so I believe that you have taken a look at the two manifestos of the two major political parties. The new Patriotic Party launched its manifesto first, and then subsequently the NDC also launched this manifesto. They all talk about various approaches to healthcare and all that. First of all, your preliminary observations about the two manifestos when it comes to the issues of health.
Well, my observation is that, thank you, Wilberforce. My observation is that both healthcare manifestos kind of align. And I looked at that of the NDC. They were talking about maternal mortality, that's reducing it. And also I looked at the NPP. The NPP was talking about increasing the number of health professionals in the country. And for me, looking at both, one of the key things I am looking at from an angle of an independent person, where I think the people want results. So both of them, what they have put on the table, what we want to see as a people is results, to see that everything that they've put on the manifesto comes to life. So for me, they are both great, and I look forward to something positive.
Okay, so your preliminary comment really is the fact that both sides have certain approaches that they are putting up. But let's start from health infrastructure.
Okay.
Health infrastructure, because first of all, there must be the hospital sitting there before you can even go to the hospital.
Right.
So this particular government currently is building Agenda 111. Agenda 111 is supposed to build 88 district hospitals across the country in the districts where they don't have hospitals, and then also build new regional hospitals, and then I think a mental facility and all that. What do you see in terms of the infrastructural approach by the NDC as compared to the infrastructural approach to the NPP? Now, the reason is because we are seeing that there's a difference in approach to expanding healthcare access, enhancing infrastructure, and addressing specific health needs. So if you look at the preliminary stuff that we have done, we say that both parties place a strong emphasis on the healthcare infrastructure development. The NPP is focusing on completing its Agenda 111 project, which involves building 111 new district hospitals, regional hospitals, and specialized healthcare facilities. These initiatives aim to improve access to healthcare, especially in underdeserved areas. I don't know what you mean by underdeserved, but maybe underprivileged areas. But you would also notice that the NDC also plans to invest in healthcare infrastructure, but emphasizes upgrading existing facilities and expanding the capacity of healthcare institutions to provide specialized services, particularly in remote regions. So healthcare infrastructure, there's a major infrastructure build underway by the NPP. It's assumed that once NPP wins the elections, they will maintain that. But the NDC is not the initiators of Agenda 111. And we have seen occasions where infrastructure is begun by one government, another one comes in and doesn't prioritize it, and so leaves it and goes to chase their own. What do you make of this infrastructural needs and how the two parties are attempting to deal with it?
Right. Wilberforce, you remember when I started speaking, one thing I said was that
the word actually should be underserved.
Underserved
areas. Yes. So it's underserved areas, not underdeserved. Underserved areas.
Okay.
Please go ahead.
So Wilberforce, you remember when we started speaking, one of the things I said was that the people want to see results. So if one party starts a development on healthcare, I think it should be continued, because once it pauses, it affects the people involved. So if the Agenda 111 is being started, then I think it should continue, because once it pauses, the people suffer. So what I said from the beginning, that we are looking at results as a people in the country. So development shouldn't pause in any way.
Obviously, if development pauses, that means the country fails to exist, really.
Yeah.
Okay. So, but I needed to touch on the approach of the NDC, where they say that it plans to invest in healthcare infrastructure, but emphasizing upgrading existing facilities and expanding the capacity of healthcare institutions. So the NPP is saying that there is a need which they are trying to fill, and that need came about by virtue of COVID-19. COVID-19 exposed us, and so the government is trying to fill that gap that was discovered after COVID-19. The NDC is, on the other hand, saying that there are already existing facilities that they will focus on expanding instead of building the new ones that the current government is approaching to do. What is the gap there? I see a gap, don't you see?
I would say that even though there's a gap, development does not pause in any way. It does not pause in any way. So if I want to bring something new into a country, if there's improvement that needs to be done already, I think that also needs attention. So we should focus on improving the healthcare as well as bringing new initiatives. So for instance, if they want to improve upon the healthcare, it's a great deal. And also if they want to bring new initiatives on board, that is also great for the country. Because my standpoint is always on the people want results. So once the people are okay with development on what is happening for them, it is great.
Okay, so the new Patriotic Party in its manifesto outlines plans to improve maternal and child health services by increasing healthcare facilities, offering such services and providing training and resources to healthcare workers. The party's goal is to reduce maternal and infant mortality. But the NDC, on the other hand, is saying that it wants to prioritize mental and child health, proposing free maternal healthcare services and enhancing access to prenatal and postnatal care. Like the NPP, the NDC aims to reduce maternal and infant mortality through targeted healthcare programs. So essentially, the two parties appear to be in sync when it comes to maternal and child healthcare. I want your thoughts on the approach the two of them are using, as I have read.
Thank you. Wilberforce, for someone who is interested in doing a PhD in counseling and mental health, it's an area that I am more interested in, that it should be prioritized. So once both of them are in sync, I think it's a great way to go, and we're hoping that it's going to happen and help the people, because mental health is something that I have noticed that is not really prioritized in this country. So for me, it's a great deal. It's something that when I saw in the manifestos, I was really happy. So both of them, just as you said, are in sync, and we look forward to a great sustainability and results.
Okay, so we've been joined, I should say, via video link by Gloria Ofori-Boadu. She is a lawyer in private practice. She's managing partner at GOB Law Consult, and he's also a law lecturer. Good morning to you, Madam Gloria Ofori-Boadu.
Good morning. Good morning.
Yes, ma'am. Thank you very much for accepting to speak with us here on Asaase Radio. I want your thoughts quickly on, first of all, a first part of this conversation that we have had when it comes to infrastructure, in terms of healthcare infrastructure in our country. Currently, the new Patriotic Party is on a mission to build 111 hospitals across 88 districts and regions and what have you. And the party is saying in this manifesto that it will continue this agenda and probably add to it if it retains power in 2024 in the elections. The NDC, on the other hand, is saying that it thinks that the existing infrastructure should be upgraded and existing facilities expanded instead of the building of new ones. Your quick thoughts on this agenda of the two major parties, one wanting to expand facilities, the other wanting to build more facilities. What are your thoughts, madam?
Well, I will say that I'm in for the Agenda 111 because it's so impressive. I don't even know if the Western world has something like that. I remember the U.S. commended the Nana Ado Bawumia government. Kamala Harris commended them for the zip line, the drones. That was very innovative. And so this 111 is also very, very innovative. And I just pray that Ghanaians will vote the NPP into power so that they can continue with it. As for expansion of existing infrastructure, I think that's limiting.
Okay, so limiting. Can you expatiate on your choice of words when you say limiting?
It's limiting because the existing infrastructure is inadequate. So instead of spreading it so that there's easy accessibility for all citizens, including those in rural communities, the districts, instead of doing that, we are just going to focus on the existing and expand. I don't think that is appropriate. We need to have health for all and very close to their doorstep, especially when we want to curb maternal mortality and child mortality in the nation.
Okay, so I see that Ewurabena tends to agree with the submission. If you have a quick reaction before I go back to Madam Ewurabena.
Yes, so I agree with what she's saying. If we are just improving upon what we already have, we are not going forward. So just as I said earlier, we need to look at both ways. We need to improve upon what we have and then bring in new development as well, especially in the rural areas. I am more interested in rural development and also the maternal health because I'm a woman. So, yeah.
Yes, so on that woman note, I'm coming to you again, Madam Gloria Ofori-Boadu. Maternal and child health care is also a priority to the two major political parties. I read earlier on that the NPP has outlined plans to improve maternal and child health services by increasing healthcare facilities, offering such services and providing training and resources to healthcare workers. The party's goal is to reduce maternal and infant mortality rates. Meanwhile, the NDC is also trying to prioritize maternal and child health care, proposing free maternal health care services and enhancing access to prenatal and postnatal care. Like the NPP, the NDC aims to reduce maternal and infant mortality through targeted health care programs. So the two major political parties are planning to reduce maternal health care concerns in our country, or reduce maternal and infant mortality through targeted healthcare programs and approaches. I want your thoughts quickly on these two approaches and whether or not it is capable of helping us achieve this target that the party set for themselves in terms of reducing maternal and infant mortality in the country, Madam.
Yes, I believe that a nation can never be planned unless we look at the future. And the future is the unborn child and the children who have been born. So the NPP has prioritized it by looking at opportunities to increase resources, infrastructure and services and training for maternal health and child health. I think that's very important because I keep saying that right now, some people have to cross rivers or put bicycles, try cross rivers with bicycles sometimes to get mothers to the nearest.
Okay, Madam's link appears to have gone off. Do we still have Madam on? Okay, so, hello? Okay, so we'll try and
all these infrastructure to the doorstep of its citizens, and also train resources, train human personnel. That's also very important.
Okay, so on the issue of health personnel, let me come to you, Ewurabena, and I'll come back to you, Madam Gloria Ofori-Boadu. So on issues of health care and the workforce, it's extremely important. So you have the hospital facilities sitting there, you have equipment in there, but if you don't have the workforce in there working to administer the health services to the people, then it is still much ado about nothing. So there's this, let me just read it shortly and then I'll ask my question. So the healthcare workforce is a critical aspect of both manifestos. The NPP plans to improve the healthcare workforce by increasing the number of healthcare professionals, providing continuous training and development, and improving working conditions for healthcare workers. The NDC also emphasizes strengthening the healthcare workforce with plan to recruit more professionals, improve salaries and work conditions, and offer opportunities for professional development and specialization. We have a situation where we know a lot of our healthcare professionals are going out of the jurisdiction, seeking greener pastures and all that. So what are your thoughts on the plans of the two political parties to improve the healthcare workforce in the country? Yes, I'm starting with you, Ewurabena.
Right. So for me, I would first look at the gaps. So one is looking at bringing new development, and the other is looking at improving upon what we already have. And with regards to people leaving the country, most of our health professionals leaving, if we don't take care, we'll come to a point where all those who are more like they are very good at the technicalities of the job, we'll lose them to the foreign countries. So what I am looking at is we want results. So at the end of the day, the gaps in between the two is what the gaps I have identified is that one wants to continue with what we already have, and one wants to bring new development. We want both combined for the country so that the people that we have in the country can feel secured and okay with wanting to stay in the country and help improve upon the country. Other than that, all the things that we'll have, or all the people that we'll have in the country are people who would want to go to school and then think of wanting to have a better life in another country, or take all the trainings, all the good trainings that they've had to another country. So I'm looking at we as citizens should look at the gaps in between these two, and then be able to get the government to work on getting the two together instead of just having one.
So when you say the two, you are talking about
NDC and NPP.
The NPP and the NDC, obviously. Okay, so interesting thoughts there. So let me come to Madam Gloria. If you also share with us, I believe you heard what I read earlier on and the submissions made by Ewurabena on workforce, the healthcare workforce. Extremely important because the facilities may be there, but you don't have the people working in them, then you have achieved nothing. So your thoughts on the need for workforce and the plan of the two parties to improve the workforce. Which one should we work with?
Well, I'll say that there's this account proverb that meaning if a naked person says that they are going to give you clothes or they promise you clothes, just remember the name of that person. The person is naked. You know, when it comes to payment of fees and allowances for nursing students and health workers, I think the NPP has the track record for doing that and the NDC doesn't. So if we are looking at the track record, then the NPP is way ahead when it comes to providing resources for health trainees. And I believe that the manifesto, the Dr. Mahamadou Bawumia manifesto for 2024 indicates that this will be continued, the resourcing of health trainees. And I believe that even when it comes to migration of health workers, there's a formalized structure that I think has been established between Ghana and Barbados, right?
Sure, yes, there is.
Yes, so all these have already been put in place. So it's just a matter of building up on them for the future, training, resourcing, exchanging health workers across the globe to learn better, practices, coming back. It's ongoing. So a vote for the DMB government is a vote for continuity. I think that is safer for us, okay, than to start with someone who a party that doesn't have the track record like the NDC, and hoping and believing and wishing that they will do better based on something that has been put in their manifesto.
Okay, so
when it comes to human lives and health, there's no time for hoping and wishing and trusting. It must be done. It must be seen to be done, and there must be a track record for that purpose.
Okay, so clearly stated there by Madam. But let's wrap up our conversation this way. In terms of pharmaceuticals and medical supplies, that's also a very important area. And I'm going to start with you, Ewurabena, on this as well. So the NPP manifesto includes a commitment to improving the availability and affordability of pharmaceuticals by supporting local production and reducing dependence on imports. They plan to establish a national drug distribution system to ensure a consistent supply across the country. The NDC shares a similar goal with a plan to support local pharmaceutical industries, improve the distribution of medicine, and ensure that essential drugs are available in all healthcare facilities. And so, Ewurabena, there's a issue of pharmaceuticals and availability of drugs. The NPP is proposing to establish a national drug distribution system. The NDC doesn't propose to establish any such system, but they also say that they support the improvement of the availability and affordability of pharmaceuticals in the country. Your quick thoughts.
So for me, I think they are both great suggestions. And what I am asking is, what would they do to retain these? So it's not just bringing them, but what are they doing to retain them?
When you say retain them, what do you mean? You introduce a policy, for example, the NPP is saying that they want to introduce a national drug distribution system. When they introduce it, you are talking about its sustainability.
It's sustainability, The people are looking at sustainability. So you're bringing it, how are we going to sustain it? It's the future that we are looking at. So something that we are not just introducing into the country. We want it to grow. We want it to be known by it as, okay, in Ghana, this is what we're good at. If we are doing local medicines, that is going to help the people in the country. How sustainable it is. How are we going to improve upon it such that it will even be recognized outside of the countries? As in, different countries will recognize Ghana for such pharmacy improvement.
Okay, so I get your point, and the point is that introduce the policies anyway, but sustain them and grow them so that it becomes the envy of the region, perhaps. Okay, so let me pick the thoughts of Madam Gloria Ofori-Boadu on this matter. Madam, you heard me read the position of the NPP when it comes to commitment to improving the availability and affordability of pharmaceuticals, and that of the NDC. Essentially, the NPP's new innovation is the establishment of a national drug distribution system, which will ensure a consistent supply across the country. That, for me, is quite interesting. Your thoughts, please.
Yes, I always say that it's always good to have an implementation plan. The NDC has just stated support. How are they going to support? Now, on the other hand, the NPP has shown that they will continue with their track record. Look at COVID. During the COVID time, the president prevailed on local pharmaceutical companies to manufacture a lot of medication. And that is continuing. For example, the drug called, zithromycin, it's something to do with, curing COVID. The Pfizer, the imported one, costs 120 Ghana cedis. And the NS Chemist medication, which is equally effective, costs 24 Ghana cedis. So that's the clear case of affordability by the NPP government. So it's just a matter of continuing with what is being done. And that has been stated clearly in the Dr. Mahmoud Bawumia's 2024 manifesto. I think the NDC should do better than just saying we support, making blanket statements. There must be a process, an implementation plan indicated in the manifesto, as has been well done by the NPP, and as is being implemented.
Okay, so quickly from you, I'll come to you, Ewurab, to react to that. Oh, you wanted a reaction. Okay, so let me get you to react to this quickly, then I can continue.
So I would want to add up to the pharmaceuticals. The question is, how long would it take to build the raw materials that would be used? And then how potent would the drugs manufactured be?
How potent would they be? Okay. Yeah. All right. So I wanted us to wrap our conversation with digitalization. Now, because digitalization has found its way into healthcare, and we've heard Dr. Mahmoud Bawumia, for example, talk a lot about digitalization in healthcare. So both parties acknowledge the potential of digital health solutions. The NPP promotes the use of telemedicine to expand access to healthcare services, especially in remote areas. The party plans to implement digital health platforms that will connect parties with healthcare providers, making healthcare delivery more efficient. The NDC also supports the adoption of telemedicine and digital health technology to improve healthcare access, particularly in rural and underdeserved areas. And so, Madam, I'll start with you, Madam Gloria Ofori-Boadu. The issue of digitalization, of course, nobody can take away digitalization from Dr. Mahamudu Bawumia. He is the one who led the introduction of the delivery of health needs and health equipments and what have you, or medicines by drones in our country and all that. He seems to be championing digitalization. I want your quick thoughts on the role you think digitalization will play in healthcare, and which of the two parties proposes a better way out with the use of digital health facilities.
Yes, back to my account proverb. If we are not petututu. If the entertainment in our communities is going to be lively, it starts very early at dawn. And so I believe that right now, looking at the two parties, the government of the NPP has started early at dawn with this zip line, drone delivery of blood and other medical supplies to remote communities. And that has been commended by the US government. So it's just a matter of continuing with what has been done. Apart from that, now there's interoperability when it comes to data and sharing internet information, and also even sending funds across different cell phone companies. So with that, it's made data, internet, digitalized, infrastructure very affordable, even at the rural communities. I hail from a rural community, and I'll say that majority of them are online on Facebook, internet, and what have you. So we need that basic infrastructure, and it has been done by the NPP government, specifically led by Dr. Mahamudu Bawumia. So that is something that has started and done and needs to continue. We don't need or have to experiment with another party that has not done anything when it comes to that. So that's all I will say, that the entertainment started, the process has started at early dawn, and it must be continued. It must be sustained, than to leave it to a policymaker or another party that has never done something like that.
Okay, so your thoughts are clearly established there. Thank you very much. Madam Gloria Ofori-Boadu is a lawyer in private practice. She's a managing partner at GOB Law Consult, and she's also a law lecturer. Let me pick your thoughts. You have the last word today on the issues of digitalization and healthcare. I
will comment digitalization, the use of drones, Ghana card, and we as Ghanaians being able to renew NHIS on phones is commendable. It will help with efficient healthcare and paperless system at hospitals and healthcare. For me, I'm looking at digitalization in the rural areas. How fast are we going to get that done? And also, how efficient is it going to be in the rural areas? It's a great approach, especially by the NPP, and I'm happy for that. So how will it be implemented faster at the rural areas within the new hospitals that will be built, and also in the capital as well?
Okay, so the voice you just heard is the voice of Ewurabena Quainoo. She's a journalist, a PR professional, and a development consultant. Thank you, Ewurabena, for joining us here on the Asaase Breakfast Show. Earlier on, joining us on Zoom was Madam Gloria Ofori-Boadu. She's a lawyer in private practice. She's a managing partner at the GOB Law Consult, and she's also an adjunct lecturer. Madam, where were you lecturing? Is it GIMPA or University of Ghana? Madam Gloria, where were you lecturing? Is it University of Ghana or GIMPA?
Oh, I've been lecturing at GIMPA.
GIMPA,
and then I've done some at the University of Ghana, the LLM program.
Okay. So one of the people who said you taught him was Nikbakpo Samoa Ado. I remember that. Okay. So, Madam, thank you for joining us via technology today. We hope to see you in the Asaase studios sooner rather than later. Thank you, ladies, for your conversation.
Welcome.
So, yes. So you are on Asaase Radio 99.5 in Accra. It is 100.3 in Cape Coast, 98.5 in Kumasi, and 99.7 in Tamale.